When a person has suffered a stroke, that's injury to the brain because of a blockage of a vessel in the brain. Rapid assessment and treatment is key. The process usually starts either out on the field by EMS or when the person enters the doors of the emergency room in the hospital. At that time, a stroke code is activated that alerts all of the appropriate medical staff to respond. A rapid assessment then occurs, and a patient is taken straight to a CT scanner where more tests can be done.
A CT scan is one of the first and most important tests that we do on stroke patients. There are two main reasons we get CT scans. One is to determine how much injury has occurred to the brain thus far, and two, to see if there has been any bleeding in the brain, which can be important in deciding whether or not to give powerful clot-busting medications through the IV.
Once we have determined that a person is having a stroke and is an appropriate candidate for this strong blood clot-busting medicine called TPA, we then evaluate the risks and administer the medicine if deemed appropriate. Sometimes this medicine is effective enough to stop the stroke, but sometimes we need to move on to other interventions, and that's when our neurointerventional colleagues can take over.
For a subset of strokes, those that are due to blockages of the largest arteries of the brain, endovascular treatment may be an option. This group of patients can include patients who are unresponsive to IV TPA or patients for whom IV TPA is not appropriate. We have a number of technologies available to us for removing blood clot from the brain. The technologies range from applying direct suction to the clot and removing it like a vacuum, or mechanically extracting the clot using special devices called stent retrievers.
Stroke is a devastating disease, but with early recognition and early treatment, it doesn't have to be.
Today, both IV TPA and endovascular treatment are proven therapies that can improve patient outcomes if delivered rapidly.